Back. Thank you so much for staying with us. It's time for To The Point, and our conversation tonight will be on International Day for Older Persons, which was commemorated on the 1st of October, that was this Tuesday. And our To The Point aspects tonight will be policy implementation and social protection, healthcare access and support, inclusion and participation. Now, the International Day for Older Persons, as you can see on your screen, was adopted on December 1990 by the United Nations and was officially flagged off on the 1st of October 1991, while the United Nations came up with a couple of resolutions that were aimed to recognize the significant contributions of older persons to society and to raise awareness of the opportunities and challenges associated with aging populations globally. Let's take a look at the key resolutions according to the UN. These resolutions were meant to acknowledge the key points. They were meant to acknowledgement of older persons' contributions, promotion of aging-related issues, encouragement for international collaboration, as well as alignment with the Vienna International Plan on Aging. Now, our guests are already in studio. Just right next to me is Michael Kanyingi Kimoho, the founder of Mikop Kenya, as well as a geriatric care trainer. We have Gisebe Yvonne Kinanga, the only lady, okay, we are two now, the only lady between the gentlemen. Gisebe is the co-director of Ukongwe Ukongwe Bora Foundation, and we have Aboro Titus, head of programs, Aging Concerns Foundation. Now, Michael, I'll just start with you now that you fall next, right next to me. 33 years later, how are we doing as a country in terms of ensuring that the older ones, our senior citizens, are well taken care of in the society?
Yeah, one, I'll commend where Kenya is right now, because the International Day of Older People is an international day where the whole world is supposed to commemorate issues of older persons. And as is said, there is a lot that needs to be done. 33 years ago, Kenya did not have any platform for the issues of older persons. Until later, after 2010, is when things started burning up about the issues of older persons. I commend people who worked with us, Help Age Kenya, and other organizations. We agitated the government to look at issues of older persons. And we also realized that most of the policymakers did not know about the Vienna International Plan of Action for Aging, or even the Madrid Plan of Action, International Plan of Action for Aging. And it was a real task to actually educate them. But so far, so good. Quite a lot has been done, especially on issues of cash transfer and social protection. But we still need to do quite a lot, especially when it comes to issues of care and support. If you look at the theme for this year's International Day of the Older People, is aging with dignity and the importance of strengthening care and support system worldwide. We'll be getting into that later on. But, And I think we have done quite a bit. Yeah.
Yvonne, from Ukongwe Bora perspective, how are we doing as a country 33 years later?
I think we're doing much better. As Ukongwe Bora, what our main goal is bridging that intragenerational gap between the older persons and the younger people. I think in terms of the older persons and the younger people, we're starting to go a bit far, because you remember back then, community was a very strong pillar in the society, and the young people understood the value of the older people in society. They understood the value of the older persons. And I feel like now that we are starting to grow apart from that community background, I feel like we're starting to go back, but that is what Ukongwe Bora is willing to do. It's willing to bridge that gap, to bring the elderly and the young people together, to show the young people that we need these older people in our society, that we need to respect them, and we need us as the younger people to care for them most importantly. So far, so good. I think we still have so much to do. Yeah.
Do you get good feedback from these younger people in terms of trying to create this intra-generational?
Yeah, of course. The feedback is good. I think now for us as Kongwe Bora, our goal is to actually bring the young people. Some of them might not know that this is an issue that we have, and that's our goal, to bring them together so that we can tell them, guys, we need to help our older people, our older generation in this way, or any other way that they might need.
All right, Titus, you are celebrating the International Day for Older Persons in Western, if I'm not wrong. 33 years later, how are we doing?
Yeah, I think I'll agree with the rest of my colleagues. We've made some good steps. And if I look at it from the community level, we have had a lot of older persons organizations that are emerging and continue to emerge, advocating for the rights of older people. We have institutions of older persons spread across the country in different counties. Aging Concern Foundation is one of them. And we have managed to come up with what we call OPS, Older Persons Associations. And these are just groups of older people where they come to engage, interact, and of course have a way of advocating for their own issues. We believe in the principle of nothing about older people without older people. And therefore creating platforms where they can talk about their issues is a step that we can talk about as a country. But looking at it at the national level, just this year, there's a proposal for us to have a law for older people, which I think is at the center of it all. We need
that is the Social Protection Bill, right?
No, it's the Older Persons, the Older Persons Bill, 2024.
Okay.
We participated in it. Public participation was arranged across the country. We took part in it as civil society, and I think that is a great step, because we need a law that can comprehensively protect the rights of older people. So if that sees the light of day, that will be a major milestone. But even going beyond what the national government is doing to other actors in the space of older people, we are here now because of resolution number 4, creating collaborations. If you looked at the resolutions when IDOP was adopted, resolution number 4 was supporting collaborations, and to have the media invite civil society organizations to talk about IDOP is a step. I mean, older people's issues are going to be discussed today. Some people will read about it, others will watch about it. So that's a great step when it comes to advocacy. And even going beyond local actors, looking at the regional conversations that are happening, Kenya is among the many African countries that have signed and deposited to Addis Ababa the Africa Union Protocol to the African Charter on the Rights of Older People. Great milestone. And so probably I'll talk a little bit more about what has been done in social protection, because there are some really good steps there as well.
All right, we will be getting deeper into that too.
Yes.
All right, but speaking of bills, Yvonne, I understand that last year you, together with your team, you submitted a bill in Parliament, or you are pushing for a bill that was going to create centers for older persons in Kenya, right?
Yes.
How far?
I think that's what Titus said, that it's one of the steps that we are championing towards, to actually bring this bill into place. That bill was redefined, we looked into it, we saw what we could take, what we could take out, and I think also other players came into the whole step, and they all came with ideas. So I feel like we still have that to see if it will come into place, but it will be a good idea to have public homes, public funded homes for the elderly.
All right. Michael, do we have these elderly persons home in the country as we speak? And how many?
We have quite a number of private homes. And we also have the government-funded model home in Kirinyaga, in Moya, which is actually meant to be a sort of rescue home for older people. most of the homes that are there now, most of them are funded by the churches, and others are very private. We have one just across here near Ruda, which is actually apartments for older persons where they live in a community. But we still need to look at the way we are formulating the issues of older persons' homes. One question we need to ask ourselves, do we need to strengthen the home care system more, or do we need to look at issues of building more homes? And the buck stops with the older persons themselves. Because as I usually say at MICOP level, we believe that older people need to participate in their own issues. They need to make decisions. And we cannot pick people because they are old and take them to the homes if they don't want. So we still need to look at, before increasing the homes, how are those ones that are there doing? There is a lot of controversy over some of them where older people are being killed. And that is one home or two. But we have not done enough research to see what is happening to the others. But at least we have homes where we can take our older persons.
All right, there's something that I need us to react to. But in hindsight, the International Day of Older Persons was established to advocate for the rights and well-being of the elderly and to foster appreciation for their contributions to sustainable development. Simon, if you can cue that bite for us.
Mimi ni mwalimu, nimestaafu na miaka 72. Mpaka sasa sijapata pesa za inua jamii ambazo zimenisaidia kutatua matatizo yangu ya kwenda hospitali na nini.
Kwanza hali ya mwili si sawa, na hata mankuli tuseme hali nkauka. Misaada tutokea huko, hata Pagariseni kuna watu wanapewa misaada, hata majirani hapa wapiti, tunasikia habari watu wanapewa chakula, lakini hayo ni shauri yao. So wanajua, lakini kuna ubaguzi fulani. Watu fulani wana haki, watu fulani wana haki, hata huyo hapati. Kwa hivyo tuna ubaguzi, tunabaguliwa.
Well, now, those are only two elderly persons who have talked about the challenges that they're facing, including discrimination. Some are saying they're hungry. But how many elderly persons have not come up to talk about the challenges that they're facing? A reaction to that, Michael?
Quite a number of older people are being victimized. They are going through a lot of challenges because of discrimination. But as organizations as we are, Titus, myself, and Yvonne, and the others who are not in this scene, we are doing quite a lot to see whether we can pick up those ones who are really needy and also get enough evidence to tell the government this is what is happening. These ones are talking about food. There are more older people in Kilifi and Kisii who are not sleeping because they fear they may be killed at night. So the issue of discrimination, the issues of violence on older people is rife, especially in Kenya. But we are not really going to blame Kenya as a state only. I represent older people at the global level. A co-chair of the General Assembly of Partners for Older Persons at the UN Habitat. And these are some of the things that come out in most of the countries.
Titus, a reaction to those sentiments?
Yeah, ageism, we call it ageism, discrimination on the basis of age. It is there. We cannot say it is not there. But then for me, looking at the role that we play as civil society, which essentially is to identify areas of inequality, okay? And earlier on I talked about community groups, which are really good areas and platforms for conducting advocacy on issues of age discrimination. When it comes to the older persons cash transfer, a lot has been done. I don't know how old the video is, but looking at...
It's as old as today.
It's as old as today.
Yes.
Looking at some of the steps that has been done to make OPCT more accessible and served with dignity, before, older persons would get this money after almost 8 months or so. And some of the great advocacy efforts of some of the older persons organizations in this country was towards predictability, making it predictable. That by the end of the month, an older person knows they will get some 2,000. However small it is, let it be predictable. And we managed to achieve that. Now, there are other comments and feedbacks that are coming in terms of what needs to be improved. And I think those are necessary for us to receive those kinds of feedback, sit together with our ministry, the Ministry of Labor and Social Protection, and see what can be addressed. I know right now the government is working on digitizing access to OPCT and many other efforts that might not be communicated already. But then that is really where we come in as civil society, you as media. We need this information to be able to realign and redesign our advocacy so that our conversations with the government, because we have a lot of those conversations through the ministry and through their county structures. They have a very elaborate county structures. There's a county coordinator for social development. At the very lower level, we have the social development officers. We have a lot of conversations with them in different platforms at the national level, at the community level, during such international elderly days. And therefore, we need this kind of information really to influence, because it is them who can take action. For us is to disseminate as much as possible.
All right. Yvonne, do you agree that a large number of elderly persons, we've only seen 2, are still living below the poverty line in their areas?
100%. I do agree with that. Looking at the state of the older persons, even in counties like Kilifi and Kisii, where we see elder abuse is more prominent, even their standards of living is very low. And I think this is one of the issues that brings about the elder abuse. The lack of enough money, the lack of enough, or even sources of them to make money due to their age and what we would call ageism, the age discrimination. Yes.
Now, Titus, Michael mentioned that the buck stops with the elderly. But do you think that these elderly people are really given a chance, an opportunity to air their views on matters that are most affecting them?
There are opportunities for older people to air their views.
But are they given to them?
I talked about nothing about us without us. Right now, older persons have been given an opportunity to talk about International Day of Older Persons. Michael is an older person. I have interacted with him many times. Yvette represents an older persons organization. I represent an older persons organization. So those are opportunities to represent the views of older persons. Again, I think that we must also appreciate some of the national priorities, all right? And even if, I mean, look at it broadly. Africa is perceived to be a youthful continent, you know. It's a continent of young people. And what that has also done is that a lot of investments, including opportunities to hear from these groups, has been directed to the youthful population. And maybe that is where probably our senior citizens are somehow left behind, because a lot of effort is towards the youthful population. And this is not a competition at all. We believe in the principle of equality. We believe in sustainable development goals, which says that leave nobody behind, and therefore including older persons in every conversation is definitely key.
All right, I want us to take a look at the social protection access for older persons in Kenya, a comparison between 2023 and 2024. Now, in 2024, approximately 26% of older persons in the country are accessing social protection programs, and this is according to the Social Assistance Bill 2024 and recent reports, of course, from Help Age International. And as of 2023, access was at 20%. That is a 6% increase compared to last year. Well, 6 is quite notable, however little that could be. But what are really the factors that are contributing to such an increase? 20% and then 26% in 2024. Michael?
We had the mass registration of older persons cash transfer last year. And the number increased from 833,000 to 1.2. And because of that legislation, we had that increase. Older people are also getting some knowledge, some awareness about registration. We have also removed the barriers that were there before. Before 2023, the registration was done by the chiefs and other administration staff. And I can say this without fear of contradiction, that most of the people who are getting cash transfer then were relatives of the chiefs and the who is who, until there was mass registration. But we still need to look at 6% increase. We can sing something home about that, but we still have a long way to go. When you have 26% of 100% older persons, then we need to do quite a lot about that.
Right.
Yeah.
Yvonne, do you agree?
I agree we have a lot to do. I think with 6% increase, it's still a bit little considering all the older people that we have to reach to. Some of the problems that we are facing or the government might be facing in increasing that percentage might not necessarily be due to the shortfalls of the government, but maybe even some of the problems that are actually facing the elder people in their own homes, in terms of their health, in terms of how are they able to walk to maybe where they need to register themselves and things like that. So I feel like we still have a lot of time for us to come up with ways that we can reach to every single one of the elderly people, and I think that is very possible. Yes.
Titans, of course, we still have a very big gap right here to fill. What needs to be done?
Yeah. Even before I talk about what needs to be done, looking at the previous question on why the increase.
All right.
I did mention organizations of older people emerging, and these are emerging trends that we must recognize. And so there's a lot of lobbying that is happening at the ground level. And this is really bringing a lot of older persons to the limelight. So that level of advocacy, when we conduct the World Elder Abuse Awareness Day, International Women's Day in March, the International Day of Older Persons, some of the key people or stakeholders that we push to participate with us are government representatives. And so therefore they're able to hear from older persons themselves, okay? And that has really, really triggered them to act in favor of older people. But then again, this increase can also be attributed to the commitment by the President of the Republic of Kenya. I was in attendance of the 2023 Social Protection Conference at the Kenya School of Government. And while we were there, the President made a commitment to increase coverage, all right? There was a commitment by the President. And to a great surprise of many, that was implemented, all right? And so, again, that government, the commitment really helped in terms of just committing to raise the number of people getting enrolled and actually going ahead to enroll them. But again, finding that older persons are already into organized groups really made it easy. What needs to be done? I don't think we have sufficient information really on who has not been enrolled. The data that is there, it is really not disaggregated. And if we can be able to disaggregate that data such that we know which age groups are qualified for these programs and they are not in. But then, just going a little bit deeper on the issue of data, we also have, Michael alluded to it, I would call it corruption. Before, if you didn't know the chief or if you didn't know the village elder, chances of you getting enrolled would be negligible. And so if we could have a closer relationship with our local administrators so that they treat everyone who is qualified for these programs to be enrolled into those programs. But then the other thing maybe I can just mention as I close is how do we get people enrolled? If registration is being done into the social protection platform that is available for the country this month, and I am 69 years old, okay, and some 11 months, I will not be registered. However, next month, I will have qualified for registration, but I will not be registered because it is not periodic. So what more probably needs to be done is to make this as periodic as possible. And we had a conversation with our PS, Mr. Montari, earlier during the public participation for the bill. And some of the proposals he made was the periodic enrollment of older persons into the social protection mechanism that is there in the country. It has to be periodic.
All right, I want us to take a look at something that is not talked much about, and it's good that Michael is here. That is geriatrics. People don't really know what this is in broader length. A medical specialty focused on providing care for the unique health needs of the elderly. And a report from my research, we have very few geriatricians in the country. But why is this the case, Michael?
Thank you for that good question. I expected it to come out because this is a very, very important area. You are right. We have less than 5 geriatric specialists in Kenya. But one area that we are failing is because the government itself believes that when you have NCD specialists and non-communicable diseases specialists, they will act as geriatricians. And that is wrong. There is a very big difference between non-communicable diseases treatment and geriatric medicine. Issues of geriatric medicine is understanding older people. And I always, in my own way, I always say that patients don't live in books. So when you talk about issues of treatment, there are those dynamics that an older person who has arthritis goes through when a younger person also goes through arthritis. Both of them will be treated by NCD specialists. So what we need to do is to have the government commit itself, as it is indicated in the African Charter for the rights of older people, that they should take steps to increase the training of geriatric specialists and geriatricians. If I use my example, I did healthcare management in India. When I came back here, I would not fit in any job description. And it has been happening with geriatricians. Most of the geriatricians you know have done sports. They have not, most of them have not done geriatrics straight.
Interesting. I want us to take a look now, because time is not on our side. I want us to take a look at a comparison between NHIF and the new health, the new funding scheme, that is SHA. By the way, SHA promises a proper geriatric care, but from a coverage scope, basic outpatient and inpatient services was available in NHIF. There was limited coverage for chronic diseases, particularly for those in private facilities, there wasn't comprehensive geriatric care package, but in SHA, there is a comprehensive outpatient and inpatient services under the Primary Healthcare Fund and SHIF, that is the Social Health Insurance Fund. And SHA also promises specialized geriatric care, including screenings for common age-related conditions, including hypertension, diabetes, and specific cancers. It also offers the free consultations, lab tests, and medications for registered older persons. Of course, there's so much more under SHA that promises better for the older persons. But do you think that this is really sustainable, Titus, as we wind up?
I would not wish to have or to make any comments with this transition. On paper, I have seen a lot of government policies, so many. The question is always on implementation. On paper, the rollout and the transition is very ambitious. It is very promising. I am a champion for healthy aging. I believe in universal health coverage that is fit for an aging population. And all of what I believe in when it comes to healthy aging and UHC are captured in this transition. My question is the level of implementation. There's a famous Kenyan word, on the ground things are different. And so this looks very ambitious on paper, but really I would shift my focus on the level of implementation that will happen. It has a lot of promises for senior citizens. If implementation will be above average, it is good for senior citizens.
All right. Yvonne, are we over-ambitious with this SHA?
I don't say we're being over-ambitious, but as Titus has said, we shall see.
We shall see.
We shall see. If the implementation is good, well and good. If it actually goes well, then yeah.
Michael, I saw you nodding in agreement when I was reading these benefits that are in SHA at the moment. Would you say that it is a plus for the elderly persons in Kenya?
I'll give a clap for what they have done. At least the ones who have got the NCDs may get covered. But here, the last point there, we have put the cart before the horse. We do not have the geriatricians. So when you talk about comprehensive geriatric care package,
right,
we'll be cheating ourselves. So they'll go to hospital and get treated just like any other person. But the real specialty is not. Yeah, but it's a good step.
All right, due to the interest of time, gentlemen and a lady, we beg to close it at this point. Of course, there's so much we would have touched, including, as you can see, there's still so much chronic diseases management, NHIF and SHA comparison. But I'm hoping that we can have this conversation later on in broader length. Thank you so much for making time. This is To The Point and Karibuni Tena. Thank you so much for watching. That brings us to the end of our bulletin tonight. My name is Anne Odida. Our sign language interpreter tonight is Rhoda Nyamai. Do have yourself a good night.